Breaking news tonight, President Trump declaring the coronavirus a national emergency. The move freeing billions for the fight as America contracts to slow the rapidly spreading pandemic. The number of cases in the U.S. rising over 2,000, at least 49 deaths. All schools closing in a growing number of states. Millions of students impacted. Houses of worship suspending services. Landmarks, theme parks, sporting events, and concerts shutting down. The chaos at grocery stores. Lines stretching out the door. Shelves cleared out.
Nervous, scared, confused, not really sure what's going on.
But on Wall Street, stocks rebounding, the biggest rally since 2008. Also the testing crisis, drive-through stations overflowing. President Trump vowing to boost testing and saying he takes no responsibility for widespread delays. And will the president himself be tested? What he said today after being potentially exposed. On the front lines, hospitals bracing for a possible surge in patients, already reporting shortages of masks and protective clothing. Will there be enough beds? Just hours from now, the new ban taking effect on foreign nationals flying into the U.S. from the new epicenter in Europe. The race for Americans to get out. And your coronavirus questions answered by our experts.
This is NBC Nightly News with Lester Holt.
Good evening. With Americans in retreat tonight seeking isolation in the face of the coronavirus, the federal government is taking new steps forward to fight the pandemic. The president today declaring a state of emergency, freeing billions of dollars for the effort and announcing a plan to accelerate testing. But worry and uncertainty are driving an unprecedented drawdown of life as we knew it only a few weeks ago. Our team is tackling multiple angles, and Miguel Almaguer leads our coverage.
The Rose Garden. Appreciate everybody being here.
The president's declaration of a national emergency comes as the coronavirus crisis deepens across the country amid a new warning it could last 2 months. With additional governors banning large groups from congregating today, the National Guard is now active in a growing number of states. Today, scenes like this are playing out in so-called hot zones, where the coronavirus has taken a foothold in local communities. New York State now has more than 400 confirmed cases. In New Rochelle, a 1-mile containment zone is leaving many on edge.
Nervous, scared, confused, not really sure what's going on.
With one Chicago hospital turning its garage into a makeshift triage center, more pop-up clinics and drive-through testing labs are becoming inundated. In Colorado, this one can only stay open for a few hours.
There are likely thousands of cases in Colorado that have not yet been tested or whose tests are pending.
As the government urges caution, there is concern fear will turn to panic. The run on supplies and the wait to get into grocery stores, a stark contrast to normally bustling city centers and subway stations now eerily empty. In several states, every school has shuttered to slow the spread of the virus. In Los Angeles, the nation's second-largest school district, with over 500,000 children, classes are canceled for at least 2 weeks.
You know, it's hard on parents because now we have to figure out, who's going to watch our kids.
With Louisiana becoming the first state to postpone an election because of the coronavirus, some of the nation's most iconic venues are shut down. The Smithsonian Museums, the National Zoo, the Space Needle, and Disney World will close. Kerry Sanders is there.
Disney World is the largest single-location employer in the nation, with close to 70,000 employees, all who have been told they will still get paid while the park is closed.
Today, more high-profile cases confirmed. Canadian Prime Minister Justin Trudeau's wife has the virus, along with Miami's mayor. But as the number of cases rises, so do the number of recoveries. Clyde and Renee Smith are now cleared from quarantine.
Be careful, but don't be afraid. It's not something that's going to jump out and grab you.
Tonight, amid a growing scare, a voice of reason, hoping to offer a sense of calm during a crisis.
Tonight, the president says at his urging, several major cruise lines have agreed to suspend outbound service from the United States for the next 30 days, what could be another mitigating factor in helping control the spread of the coronavirus. Lester.
All right, Miguel Almaguer, thank you. And as President Trump declared that national state of emergency, Wall Street rallied on the news, the Dow gaining almost 2,000 points, erasing most of yesterday's historic loss. Kristen Welker now with more on the president's new plans.
Tonight, a show of force from the Rose Garden as President Trump, flanked by major CEOs and his task force, announced a national emergency.
I am officially declaring a national emergency. Two very big words. The action I am taking will open up access to up to $50 billion.
The president saying he will also urge states to set up emergency operation centers, call on hospitals to enact emergency preparedness plans, partner with private companies to increase testing abilities, and set up drive-through test sites.
The goal is for individuals to be able to drive up and be swabbed without having to leave your car.
The markets rebounded after suffering their worst day Thursday since 1987. But the president has come under harsh criticism for failing to act quickly enough, with reports of test kit shortages all across the country, something his own top doctor, Anthony Fauci, said was a failing this week.
It is a failing. I mean, let's admit it.
President Trump responding when pressed by NBC News.
You take responsibility for that, and when can you guarantee that every single American who needs a test will be able to have a test?
No, I don't take responsibility at all, because we were given a set of circumstances, and we were given rules, regulations, and specifications from a different time. Wasn't meant for this kind of an event with the kind of numbers that we're talking about. This will start very quickly, and we'll have the ability to do in the millions over a very, very quick period of time.
The event was not without mixed messaging. The president shook hands with a few of the business leaders, despite CDC guidance to avoid that. And at times, he seemed to downplay the urgency.
5 million within a month, I doubt we'll need anywhere near that.
And just last week, Mr. Trump was pictured standing next to a Brazilian official who was visiting Mar-a-Lago, who later tested positive for coronavirus.
Are you being selfish by not getting tested?
Well, I didn't say I wasn't going to be tested.
Are you going to be?
Most likely, yeah. Most
when
likely.
Do you think
not for that
happen?
reason, but because I think I will do it anyway.
Will you let us
fairly
know the
soon?
results?
We're working on that. We're working out a schedule.
Now, NBC News has confirmed a second person who visited Mar-a-Lago last weekend has tested positive. So far, no response from the White House. But Mr. Trump said today he has no symptoms. Also tonight, House Democrats say they have reached a deal with the White House for more funding for those impacted. Lester.
All right, Kristen, thank you. And as you mentioned, the president called on every hospital in the country to activate emergency plans. But some experts warn the system may not be ready. Here's Tom Costello.
On the front lines of a pandemic that promises to only get worse, America's hospitals are already straining. In hard-hit Washington state, Providence Regional Medical Center Everett has seen double-digit cases of coronavirus. The medical director worries about what's coming.
What do we do if we have a limited number of ventilators and more patients than ventilators available? What do we do if we have more patients than beds available?
Nationwide, the U.S. has just 46,000 ICU beds, but a report suggests at least 200,000 people could need ICU care, perhaps many more. Hospitals have 160,000 respirators on hand, but a pandemic like 1918 could require more than 742,000. Already, hospitals are reporting shortages of masks and protective clothing. The country's EMS system is also bracing for a surge in coronavirus calls. There are 21,000 EMS systems in the country. 60% of their calls are basic first aid. But when a patient is struggling to breathe, it becomes a priority.
The dispatcher is telling us that this patient does have a cough and does have a fever.
Every Montgomery County, Maryland fire unit now carries an infectious disease bag with masks and face shields. The department is still waiting on 5,000 professional N95 masks it ordered in January. To conserve, firefighters were today told they should use the same mask all shift.
Take them off, place them in a paper bag, reuse them for the next person during their shift.
In Korea and Italy, the military has been called in to disinfect homes and check cars. An emergency move with a global healthcare system under stress. Tom Costello, NBC News, Rockville, Maryland.
That new ban on foreign nationals traveling from Europe to the U.S. takes effect at midnight Eastern. And with U.S. airlines also set to cut flights, some Americans are scrambling to get out. NBC's Keir Simmons is in London.
Tonight, we're just hours away from President Trump's Europe travel ban kicking in. Citizens from 26 European countries barred from entering the U.S. Americans are not impacted by the ban, but will face voluntary quarantine, the president said tonight.
Any of the families returning from Europe will be subject to extra screening as well as self-isolation for a period of 14 days.
Many Americans are trying to get out, with airlines like Delta and United announcing they will start to reduce flights from Europe.
Yeah, we got scared.
The travel ban comes with Europe now the epicenter of the pandemic. 70% of new coronavirus cases originate here. But many Americans say there were mixed messages when the ban was first announced. China Barrett and Ethan Smith fled Portugal after President Trump announced the travel ban. Today, holed up in a London hotel room, on hold with their airline.
We were hoping that, the government would take more concern about this, that airlines would make more of an effort.
And tonight, the president says the UK may be added to the flight ban list as infections here rise. Lester?
Keir Simmons in London for us. Thank you. And the pandemic has eased in China after authorities there took extreme measures, locking down tens of millions of citizens. Our Cynthia McFadden now on whether the same could happen here in the U.S.
This alarming video from China appears to show people being forced into quarantine. It has many Americans wondering just what could happen here.
Can you envision a circumstance, worst case scenario, where the United States has to take the kind of draconian steps that China and Italy have taken?
I hope it won't come to that.
Dr. Thomas Frieden was head of the CDC under President Obama and remembers the first time he briefed him.
He asked a series of questions about H1N1, which was just emerging, and it was kind of like a fog of war reality. And he said, "This isn't going to kill 1 million people, is it, doctor?" And I answered, "No, Mr. President." But if someone asked me that today, I would say, I hope not, but it's possible.
No resource will be spared.
To help prevent that, the president today declared a national emergency, unleashing a wide range of extraordinary powers.
At that moment, special powers contained in more than 100 different provisions of law become available to him. There are powers that allow the president to shut down communication facilities, to freeze Americans' bank accounts.
Today, however, the president focused on fighting the pandemic with more money and fewer regulations. Over 3/4 of the states have already declared a state of emergency, and New York City joined them yesterday.
We're seeing intense increases in the number of cases.
The powers of the state in a public health crisis look almost like the federal government's powers during wartime. They are extraordinarily broad.
For example, in New York, the mayor can set a curfew, stop people from entering or leaving the city, shut down mass transit, and ration supplies. In addition, the police and National Guard have the power to enforce compliance with mandated quarantines and other restrictions if it comes to that.
Your right to swing your fist ends at my nose, and your right to cough up infectious bacteria or viruses does not extend to my lungs.
Whatever the legal powers, officials are counting on Americans to step up and voluntarily do what's necessary. Cynthia McFadden, NBC News, New York.
We'll be right back in 60 seconds with more on the run on supplies, how big stores are responding as online sales skyrocket, and the tough choices facing houses of worship at this uncertain time. The pictures tell the story, empty shelves and long lines as concerns about the coronavirus play out at the nation's grocery stores. Here's Jolene Kent.
Tonight, as coronavirus fears grow in this national emergency, so do the lines at the grocery store. As shoppers rushed to this Costco near Las Vegas, hundreds waited outside to stock up on supplies. At this New York grocery store, customers stood for 2 hours to check out. Aisles usually chock full of toilet paper, paper towels, cold medicine, even pasta, now lay bare with nothing left.
I showed up today and it's just chaos.
Grocery stores are trying to keep up with demand. Kroger, the largest chain in the country, says it's working to restock shelves while rationing some items so everyone can have access to the items they need. Target, Walmart, and Costco imposing similar limits. And starting Sunday, some retailers opening up their parking lots for drive-through coronavirus testing.
We're focused on a common competitor, and that's defeating the spread of the coronavirus.
For those avoiding stores and parking lots, online shopping isn't necessarily easier. Orders for hand sanitizer, masks, and gloves skyrocketed 817% last month online. Toilet paper orders up nearly 200%. With so much uncertainty, it's important to remember that supplies are still coming in. Empty shelves are getting regularly restocked at most grocery stores. As for what you really need, Homeland Security says in a pandemic, focus on the basics. 2 weeks of food and water, enough prescription drugs, and over-the-counter medicine. Lester?
All right, Jolene Kent, thank you. As the impact spreads into all aspects of American life, the Boston Archdiocese late today suspended masses as a growing number of houses of worship cancel services or move some of them online. Here's Gabe Gutierrez.
Tonight, as millions of Americans search for comfort, places of worship are taking unprecedented steps. The Church of Jesus Christ of Latter-day Saints is suspending all public gatherings worldwide. From Chicago to Detroit, mosques are canceling Friday prayers. In New York and New Jersey, some synagogues are doing the same for Shabbat services. In Washington, D.C., Episcopal churches, including the National Cathedral, are shutting down for at least 2 weeks. Has the church community ever been affected in this way?
No, we've never had anything shut down like this. You know, taking out holy water. Not in my years of church work.
The Catholic Diocese of Cleveland is staying open, but says parishioners are not obligated to attend Mass.
It is scary, but we can't stop believing in God. We can't give up hope. There's always hope.
For Christians, the debate over whether to close churches comes at a difficult time during Lent, with Easter just weeks away. Many congregations are also canceling beloved community traditions, such as Friday fish fries.
This is really something that's going to be hard for us to face.
They'll face it together, even if they're apart. A true test of faith. Gabe Gutierrez, NBC News, Parma, Ohio.
There's more ahead. In fact, up next, I'll be joined by our medical experts to answer your questions. Answers. That's what we all want during these unsettling times. And so I took many of your questions about the coronavirus sent to us via social media to our experts, our chief medical correspondent, Dr. John Torres, and science contributor Joseph Fair, who is both an epidemiologist and virologist.
Hi, Lester. This is Todd from Boston. Not everyone is dying from the coronavirus. Can you tell us what happens to people after the virus? Are they fine? Do they go back to work? Are there any residual effects? Thanks very much.
And if I could add on to that, are you immune then?
So for the largest number of people, they're just going to recover fine like they do from a cold and just go back to work, go on with their regular lives. For some people, especially if they start getting that lung damage, they can get lung issues that are going to be lifelong for them. And so that's a big problem.
Because this virus is new to science and new to humans, we have no idea how long immunity is going to last. Usually it's transitory for a month or two, but it could be longer, it could be shorter. Until we have the science, we won't know.
But not like the chicken pox, for example, you get it once and you're done.
We don't know if that's going to happen or not. We think it's going to be a little more short term, but we're not sure.
Barbara Briggs of Cabot, Pennsylvania. What can I expect if I get the virus, and what is the treatment? Is there a treatment?
So right now there is no treatment. There's experimental treatments they're using, but for people who are critically ill, they're trying those. So not in the general population. For most people, you're just going to get what seems like a cold, and you'll get through that very quickly. For some people, it might be more severe cold, and you might start getting that shortness of breath, and that's the key when you need to start talking to your doctor if you're having difficulty breathing, because that's when it could turn dangerous.
Over-the-counter medications, water.
You want to stay hydrated. You want to get as much rest as possible. If you start having fevers, especially low-grade fevers, just take the fever medications we typically talk about, acetaminophen and ibuprofen, to try and help keep it under control.
Let me take the opportunity to ask my own question. Every night we talk about the numbers of confirmed cases. Those are not people sitting in hospitals. Those are not all people. Correct me if I'm wrong. Those are some of those people have recovered and are fine.
I think that's one of the biggest misconceptions, and we don't do a good enough job explaining it as scientists and physicians. You know, when we hear numbers like 130,000 people are total infections, most people think there's currently 130,000 people lying in hospital beds around the world dying of this disease. More than half have recovered. Another 30 to 40% of those will recover and go home and be fine.
Some important facts and perspective on what can feel very scary for a lot of us. Coming up as we continue tonight, some final thoughts on the path forward. Finally, at the end of this difficult week, Harry Smith has some perspective on the challenges we face and how we are all in this together.
For us, for we Americans, it is counterintuitive. In order to come together to fight against a spreading virus, we are being asked and encouraged to do the opposite, to pull apart for a while. Those big playoff games, long scheduled family gatherings, a lot of events that define us as community, unfortunately, are also a means to make us sick. We're not going to like it, but it's time to grin and bear it, for the sacrifice is small. The more we can do to slow the virus spread, the better it's going to be for everyone. Because if we don't, the heaviest burden will be with the first responders, with the hospitals and medical staff, with the very people we will be depending on to care for and heal our inflicted friends and family. Think of it this way, that by staying home, you could save a life. And you know, that feels pretty good. Harry Smith, NBC News.
And we will get through this. That is NBC Nightly News. I'm Lester Holt. Thank you for watching, everyone. Take care and take care of each other. Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.